This is Leslie Ziegler, and I'm coming to you live from the Digital Health Summer Summit at UCSF, and I'm sitting here with Doug Foster. Hi, Doug.
Hello, how are you?
Doing just fine. Doing just fine. So you just came off stage, and would love to hear first of all what you're working on, what you're building. So can you tell me a little bit about that as Mr. CEO and founder?
Yes, would love to. So I work at DigiSight Technologies, and what we do at DigiSight is that we take diagnostics that are typically in an ophthalmologist office, and we put them onto mobile platforms. So some are app-based, some are tablet-based, some are wearable technologies. And the reason why we're taking these diagnostics and mobilizing them is that we believe that if they are mobile, if they're easy to use, and if they're low cost, then you're facilitating the creation of lots of data on patients in ophthalmology. And the reason why ophthalmology is interesting is because there are a number of chronic diseases that lead to blindness. And blindness is a significant problem, obviously, for the patients, but also for the healthcare system. And so if we can use this data that we're generating to help prevent blindness, we think it's adding value to every constituency of the healthcare system.
That's incredible. Wow. Tell me a little bit about what happened on stage. What do you think, if you had to pick one thing as a takeaway of the conversation, what would that be for those who couldn't be?
Well, on stage we were talking about data security and privacy, which for any data company and for any provider, institution, or covered entity, that's a really important topic to focus on. And I think what we all talked about on stage was that it's complicated, but it's a worthwhile endeavor to do. And really a relationship between both the covered entity and the data provider, the data vendor, is something that really needs to be worked on together. And that's just an important lesson for every developer out there.
Amazing. How did you guys get started? What was the kind of nugget of the idea?
So the chairman of ophthalmology at Stanford University, Dr. Mark Blumenkrantz, created the idea several years ago and worked on the initial diagnostics to mobilize with another professor at Stanford, Dr. Daniel Planker, who's a professor in physics at Stanford. And so they created this concept to really create better care for patients with ophthalmic conditions. So when the ophthalmic patient, someone who has a condition that leads to blindness, leaves the doctor's office, they become a black box to that doctor. And the doctors want to know how their patients are doing in between those office visits. So there's no better way to do that than to give the test to the patient and have them test at home and have the data then come back to the physician so they know exactly how that patient is doing.
Fantastic. So if people want to learn more about what you're doing or find you online, can you give me the Twitters and all the handles?
That's right. So the best place to go is our website, digisight.net. We have lots of great information and videos on that website and also contact information there.
Great. Thank you so much for being here.
Great. Thank you for having me.